The global HIV/AIDS epidemic is taking center stage at the UN this week as the General Assembly holds high-level meetings on the treatment and prevention of the disease. For 30 years now, HIV/AIDS has afflicted millions, mostly in sub-Saharan Africa, and acted as a major obstacle for economic and human development in impoverished nations. Today, world leaders hope that technology and effective planning will allow for important improvements in the treatment and prevention of this disease.
1.8 million people are dying of AIDS every year in the developing world, when its developed countries is becoming a chronic disease. 9 million people are still waiting for treatment, and their life are hanging in the balance. In the North, we are seeing a new generation born HIV-free, while each year 360,000 babies are born with HIV in the South.
Today we gather to end AIDS. That is our goal, an end to AIDS within the decade. Zero new infections, zero stigma, and zero AIDS-related death. But if we are to relegate AIDS to the history books, we must be bold. That means facing sensitive issues, including men who have sex with men, drug users, and sex trade.
One leader working to combat HIV/AIDS is Goodluck Jonathan, president of the Federal Republic of Nigeria, a country where 3.3 million people live with AIDS. That's more than any country in the world with the exception of South Africa. On Wednesday, President Jonathan held a press conference to address the status of the fight against AIDS in Nigeria.
Of course, you know, Nigeria is one country that we also have a fair share of this problem, bordering on HIV and AIDS. About 3 million people of our country presently carry the virus, or at least the issue of the full-blown AIDS. And as a government, we are totally committed to reducing this number. At the beginning, people were not too committed, and AIDS was looked at it from various backgrounds. Some people thought that maybe it's only for people who are homosexuals or people who are drug addicts who share syringes and others. But it's from 2001 that countries become so committed.
While Jonathan acknowledged the destructive role that AIDS has played in his country, he had good news to report on efforts underway to finally reverse the trends of this virus and called for a final solution to the AIDS epidemic in an address to the General Assembly on Wednesday morning. The president predicted that the effects of HIV/AIDS could decline dramatically in coming years.
The prevalence rate dropped from about 5.8 to, as at last year, to 4.1. And I believe that by the end of the MDG period of 2015, this will come down drastically. And that's one of the reasons why I have to be in the United States of America, specifically in New York, for this program. You all know that I was inaugurated just on the 29th of May. And ordinarily, I wouldn't have been here because I'm yet to even set up government. I have not appointed my ministers, but the issue of HIV is quite critical in terms of our health issues.
President Jonathan's trip to the U.S. will continue this afternoon as he flies to Washington to be greeted by U.S. President Barack Obama at the White House. Meanwhile, the Nigerian delegation to the UN will remain here in New York as they seek a solution to the HIV/AIDS crisis. Reporting from the United Nations, I'm Connor Schratz for South South News.